Mandy, the esthetician here at Magnolia Med Spa in Forsyth, and we are going to show you tonight a little bit about microneedling. So just to tell you a little bit about the treatment, microneedling is a minimally invasive treatment that basically stimulates collagen and elastin, then creating the skin to naturally go through its healing process and then create beautiful new skin. There is a small downtime of about 2 to 3 days where your skin will feel a little sensitive and have a little bit of a redness to it. But then within 2 to 4 weeks, you will see beautiful, new, glowy, healthy skin. So that is the goal. Our microneedling pen has many different stages that we can use depending on what we're trying to treat. So microneedling in general usually treats pigmentation, whether it be hyperpigmentation or trying to create melanin with hypopigmentation, lack of melanin where the skin will be white. Elasticity of the skin, the collagen production in the skin, as well as pore size, which is huge. It's not just for the face. You can also microneedle the entire body. So whether it be stretch marks or deep scar tissue that we're trying to target, microneedling is great for all of those. Our client tonight has already been numbing for about 15 to 20 minutes. So we encourage that you use a topical numbing agent on your client. And I'm going to actually remove in sections as we microneedle. You will see blood when you microneedle. A lot of times you're hitting the dermativum layer of the skin, which is in the dermal layer. That's where cellular turnover happens, and that's where we need to see that reaction happen. So I'm going to remove it in just sections, and then we'll begin our microneedling. While we are doing so, I will be applying a product that's going to be hyaluronic acid. Hyaluronic acid is a natural filler and holds its weight in water 1,000 times. So it naturally plumps the skin and helps with the collagen turnover and the elasticity. So we'll start on our client's cheek this evening, and I'm just going to remove the numbing agent here on her cheek and upper lip. I'm going to allow everything else to continue to numb and just work in sections. I'll go ahead and apply my hyaluronic to the area that we're going to work. Now, a lot of people have also heard of this treatment as far as with PRP treatments, which is platelet-rich plasma. That is our natural growth from the blood, basically. But tonight, I'm not a nurse, so I cannot withdraw blood. I'm just going to be using hyaluronic acid. All right, so we will begin to microneedle.
It looks super easy.
Super easy. You just want to really make sure that you pay attention to the skin as far as erythema or redness happening, and you don't want to overstimulate, but you do want to see activity. You do want to see a little bit of blood coming to the surface. And being parallel is important too with your pen. Making small circles to create that stimulation for that collagen elastin to happen.
She's not even blinking an eye. It looks like it doesn't hurt at all.
She definitely feels it, but it's not as bad. I think it's feels sort of like a microderm, a heavy microderm.
Right.
So if you notice, we do have pinpoint bleeding. That is what we want. And what this is actually doing is creating small channels in the skin and allowing product to penetrate. You can go and spend hundreds of dollars on different serums and different expensive products, but really only about 8% are going to penetrate to the level that you need them to work. So this allows those products after microneedling and during to penetrate deeper to the cellular level to create turnover. And that's what's going to eventually make the skin have that healthy glow and look younger. So you see blood, that's a good sign. You already see her skin starting to plump. So you want to microneedle usually no more than about 15 minutes per section or per area on the face, just depending on how aggressive you're going and what the client really needs. I'll stop here for a moment, and then what I'm going to do is I'm going to apply more hyaluronic. Because we've created those channels, now we want our product to penetrate even deeper.
That makes sense.
After this treatment, you'd want to be careful to make sure that you aren't using any kind of alpha hydroxy acids or glycolics. You want to make sure that you're avoiding any kind of retinols as well as any active ingredients on the skin. You really just want to use a vitamin C, which is great for fighting off free radicals and neutralizing those free radicals in the skin. It helps with post-inflammatory and the healing process in general. You also want to encourage the client to use some sort of peptide after this treatment to help with, applying amino acids to the skin, which go in and will help tell basically collagen and elastin to grow, to happen. So it aids in the healing and the treatment process altogether. I would suggest doing this treatment to see maximum results about 4 to 6 times. It helps with pore size as well. A lot of clients come in and want to shrink the pores. That's a big issue for clients. How that happens is basically it stimulates the collagen elastin around the pore, then plumping it, then closing the pore. So microneedling is great if you have larger pores that you want to close up.
I know I definitely have a few spots like that myself.
So now I'll just move around the face. I like to treat the forehead last because it is less skin here basically. It's more of a bone, and around the cheek area and the jawline is much more fleshy, excuse me. So I feel like it's less painful. So I always treat the forehead last when working on the face.
What would you say are some of the most common misconceptions about microneedling?
A lot of misconceptions would be that, for instance, there's like a very long downtime. They're going to look red for weeks at a time. Also, scarring is going to happen because a lot of people think it is damaging the skin, yes, but it's only damaging it at a pinpoint, very small level in order to heal properly.
Right.
So if you're damaging it or going to an esthetician or somebody who's microneedling you to a point where, your skin is bruising very bad or scarring even, they're going far too aggressive. So it should have some pinpoint bleeding, but if you notice over here now, she's stopped. She has a nice glow, and that's as aggressive we will go for her. We also will go underneath the eye tissue, but at that point you're going to adjust your pin. You're never going to go, along underneath that eye tissue, that soft tissue on a high needle pinpoint. So you just have to make sure you go to somebody that's very educated and knows what they're doing. All right, so all I'm going to do is start on this other cheek here.
She looks great.
Yeah.
Doesn't even look like anything happened, really.
A lot of clients will come in, if they have prom or a wedding, and 2 to 3 days before that event and get microneedled.
That's really quick.
Yeah, so they'll have those results for that event, and their skin looks really great.
That all looks awesome. So what would you say to anybody on the fence about doing this? They think they want to do it, they're kind of scared.
It's one of those things you're never going to step out of your comfort zone until you try it. You know, this is the hottest thing trending right now in skincare in general. It has nothing but positive results if done correctly. So it's one of those things like you're reaching that level of the dermal layer that nothing else right now really can, unless you're getting some sort of very abrasive surgery. So, I mean, I recommend this for almost everyone.
All right. Sounds great.
Yeah.
Thanks so much, ladies, for letting
You're
us take a look
welcome.
at this.
Thank y'all so much.
Yeah.